do?
Every week the feds took money out of my paycheck in case I couldn't work.
I've been denied my Social Security disability. The feds refused to pay me my money, so I hired WG.
WG does SSD.
I'm W.
I'm G.
It's not the government's money, it's your money.
You've worked long and hard for it.
And we can help. Call us at 265-HELP.
We are your local law firm.
Hopefully you get through the next several weeks absolutely worry-free, but in the event that there's a slip or a fall or something that needs some urgent care, lucky for us, Joseph Teal is on the show with us this morning. He's a physician's assistant at Center for Sports Medicine. Great to see you.
Yes, ma'am. Good morning.
So we're talking specifically that now y'all have these Saturday hours when those slips and falls occur, or I guess if you've had an orthopedic issue and there's a problem with it, you need some immediate attention. Is that
That's
right?
That's right. Yeah, we're really excited to offer this new service to the community here in Chattanooga. We felt there was a need for continued orthopedic care beyond just the Monday through Friday work week. So this Saturday urgent care clinic gives patients and the people of this community an opportunity to come in to have excellent orthopedic care given to them even on a Saturday morning.
So I mentioned kind of the obvious of a slip or a fall. Heaven help you if a Christmas light goes out and you have to go outside and replace it and you fall on the ladder. But if you've had an orthopedic issue, maybe a surgery, and there's a worry that you have, is this an ideal offer too?
Right. Yeah, you definitely, with a post-op complication, those are kind of a case-by-case basis. You can call in on Saturday morning and kind of give us some more details about what's going on with your post-op complication, or you could call the surgeon or the advanced practice provider on call. We're happy to take a look at those if it warrants an urgent care setting, but if not, we would refer you to the surgeon who performed the procedure.
So are you up and running with this now?
We are up and running, yes ma'am.
Okay, so what types of cases are you seeing? Who's coming through the door?
Right, so really, like you said, any slip or fall, a sprain, a strain to a ligament, any acute sports injury that may happen, or just the active adult who does something on a Friday night and gets hurt, they're more than welcome to come in and see us on Saturday morning as well.
You mentioned the active adult, but let's talk about those active kids. You do see children as young as 5?
Correct.
That's a good deal.
Correct.
So is it a good idea for people to call you before they come in? I know it's a walk-in, but do you want people to make sure that they need to come to you and not the ER?
Right, yeah, you can just walk in on Saturday morning, but if you have a question as to whether that issue can be seen in our urgent care clinic or at an ER, you're more than welcome to call and speak to our front desk staff. They would then come to the provider and ask us if that's appropriate for the walk-in clinic.
This time of year, you find a lot of people traveling to see family for the holidays. So if you're in town from Missouri and something happens, they can still come, right?
Absolutely.
Insurance travels across the states.
Yes, ma'am. Absolutely.
Who should not come? Is there a time when you're not the ideal fit?
Right. Yeah, so again, 5 years and up is our preferred age range. If you're less than 5, we're going to refer you out. Also, let's say you have a chronic orthopedic injury like arthritis, you've been dealing with that for some time now. If that's something that you've followed up with our physicians or advanced practice providers throughout the week, we prefer you just keep that routine follow-up, okay? Also, any second opinion. So say you're coming to Center for Sports Medicine for a second opinion. We prefer that not be seen on a Saturday urgent care and that be seen Monday through Friday with that preferred specialist.
That makes sense. Okay, you mentioned the follow-up. Part of the great benefit of coming to Center for Sports Medicine is the team.
Right.
So if somebody does come to you, they've had the typical sprained ankle or something like that, and they see you, then will you put a note in the system to refer them to a follow-up if you think it's necessary?
Right, correct. Yeah, we will have close follow-up even when we see a patient on the urgent care. We will have close follow-up with our subspecialists. So if you sprain an ankle, we'll refer you out to one of our foot and ankle specialists. If you hurt your shoulder, we'll get you set up with one of our shoulder guys, etc.
I guess sprains are kind of tender to my heart because I had a doozy when I was a kid growing up, and I learned early on that those don't heal quickly or well if you don't tend to them the right way. A broken bone in some ways is almost easier to heal. Is that correct?
Right. Yeah, a broken bone, we put you in a cast or a splint. It takes 8 weeks or so to heal. A sprain, there's different levels of sprains, obviously. So if you have a grade 1 sprain that's very low, some at-home exercises, some physical therapy, and anti-inflammatory may do the job for you. But if you get into the higher grade sprains, you may need more advanced treatment like an MRI, more routine physical therapy, things like that.
The rain, I'm sure we're going to continue to get some, and those leaves are still falling. So just kind of a word of warning to people, but is that a trigger sometimes for a fall?
Absolutely.
The debris on the road?
Right, yeah, any debris on the road, any slick surface definitely is a risk factor for a fall, so be cautious this time of year.
And I guess too, the obvious things, but back to the kids, you're a dad, your kids are littler than what you see in the office, but you'll be in contact with primary care physicians about what you see?
Correct, yeah, if we see a patient and they give us their primary care physician contact information. We're happy to fax over our progress note through our medical record system.
Well, I thank you for your time this morning.
Thank you so much.
Let me show you how you can get in touch with them, because this is a brand new offering they have to the area. So all the locations that you see there on your screen are there for you to go to Monday through Friday. Is that right, Joseph?
Correct. Yes,
but then the Gunbarrel location is the one that's now open on Saturdays. They open bright and early at 8. They're going to close at noon. Again, you can walk in if you want to, but if you want to call to double check and make sure that it's the right place for you to go and that you're not wasting your time, they'll be happy to tell you that as well. Thank you so much.
Yeah, thank you.
Have fun with Santa Claus at your house with
Thank
two
you.
little girls.
I appreciate it. You too.
West Yellowknife Trading Post has everything under the sun. Train scratch and dent heat pumps, 2-ton for only $26.90. Fujitsu split heat